This medication, Aspirin-Dipyridamole Er, is used to reduce the risk of stroke in patients who have had mini-strokes, transient ischemic attacks, or a previous stroke due to a blood clot and are at high risk for another stroke. It contains two medications, a very low dose of aspirin, 25 milligrams per tablet, and dipyridamole in a slow-release form. Low-dose aspirin and dipyridamole are antiplatelet drugs that work to keep blood flowing to the brain by stopping platelets from clumping together. This helps prevent the platelets from forming blood clots, which can lodge in the brain and cause a certain type of stroke, ischemic stroke. It is important to take this medication as prescribed by your doctor and at the same time each day for the best results. Before you start taking Aspirin-Dipyridamole Er, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food, usually twice daily. Swallow the capsule whole and do not crush or chew it. Take it with a full glass of water unless directed otherwise by your doctor. The dosage of Aspirin-Dipyridamole Er is based on your medical condition and response to treatment. If you experience certain side effects when you first start taking this medication, your doctor may temporarily change your dose. It's important to use this medication regularly to get the most benefit from it, and try to take it at the same times each day to help you remember. It's crucial not to try to replace this combination medication with aspirin and dipyridamole taken separately, as the separate medications would not work as well as this combination medication. If you have any questions, ask your doctor or pharmacist for more information. Some common side effects of Aspirin-Dipyridamole Er may include headache, nausea, vomiting, diarrhea, abdominal pain, heartburn, and dizziness. If you experience a severe headache when you first start taking this medication, talk to your doctor. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, tell your doctor right away if you experience any serious side effects, such as easy bleeding/bruising, irregular heartbeat, or signs of kidney problems. This drug may rarely cause serious bleeding from the stomach or intestines. If you notice any serious side effects, such as stomach/abdominal pain that doesn't go away, black stools, or vomit that looks like coffee grounds, stop taking this medication and consult your doctor or pharmacist right away. Get medical help right away if you experience very serious side effects, such as fainting, symptoms of a heart attack, or signs of bleeding in the brain or stroke. A very serious allergic reaction to this drug is rare, but seek immediate medical help if you notice any symptoms of a serious allergic reaction. If you notice any other effects not listed, contact your doctor or pharmacist. Before taking this medication, make sure to tell your doctor if you have any allergies to dipyridamole, aspirin, other salicylates, or NSAIDs. It's important to also inform your doctor about your medical history, especially if you have conditions such as asthma, bleeding problems, low blood pressure, heart problems, stomach problems, kidney disease, liver disease, muscle problems, growths in the nose, or bleeding in the brain. This medication may cause dizziness, particularly when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how this medication affects you. Limiting alcohol and stopping smoking can reduce the risk of stomach bleeding while taking this medication. If you are scheduled for surgery, inform your doctor about all the medications you are using, as you may need to stop taking aspirin/dipyridamole before the procedure. It's crucial not to stop taking this medication without first consulting the doctor who prescribed it. It's important to note that the amount of aspirin in this medication may not be sufficient to prevent a heart attack. If you need aspirin for this purpose, talk to your doctor or pharmacist for more information. This medication contains aspirin, and it should not be given to children and teenagers younger than 18 years old if they have chickenpox, flu, an undiagnosed illness, or have recently received a vaccine, as it may increase the risk of Reye syndrome. Older adults may be more sensitive to the side effects of this medication, particularly dizziness and bleeding. If you are pregnant, use this medication only when clearly needed, and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding while using this medication. When taking Aspirin-Dipyridamole Er, it's important to be aware of potential interactions with other medications. This includes corticosteroids, mifepristone, ginkgo biloba, and other drugs that can cause bleeding or bruising, such as clopidogrel, NSAIDs, and blood thinners like warfarin or dabigatran. It's crucial to inform your doctor and pharmacist about all the products you use, including prescription, non-prescription drugs, and herbal products. Be cautious when taking other medications that contain pain relievers or fever reducers, like aspirin or NSAIDs, as they may increase the risk of side effects when taken together with Aspirin-Dipyridamole Er. If your doctor has prescribed low-dose aspirin for preventing a heart attack, consult with them to ensure it's safe to continue taking aspirin alongside this medication. Additionally, Aspirin-Dipyridamole Er may interfere with certain medical or lab tests, potentially leading to false results. Make sure to inform lab personnel and all your healthcare providers about your use of this medication. If you or someone else has taken too much Aspirin-Dipyridamole Er and are experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include ringing in the ears, flushing, sweating, restlessness, weakness, dizziness, and a fast heartbeat. This medication is not to be shared with others. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just skip the missed one and take the next one at your regular time. Do not take 2 doses to make up for the missed one. It's important to store Aspirin-Dipyridamole Er at room temperature, away from light and moisture. Make sure to keep it in a place that's out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.